Hi, I'm Dr. Greenapple from Thrive with another Monday Motivation. You know, May is Mental Health Awareness Month and April was Stress Awareness Month. So I'm going to try to combine both of those and talk to you a little bit about today and maybe even offer some tools to see if we can help with stress, anxiety, as well as mental health. You know, it's been told to us that we have between 60 and 70,000 thoughts per day, and 90% of those thoughts we thought about yesterday. So we keep playing this loop back over and over again, and unfortunately we have a strong what's called the negativity bias in our brains. So a lot of times we get back into that reactionary fear and anxiety and anguish. So we're going to try to use a couple of tools to see if we can bring that down. Some of the first things I like to do with my patients, and even myself and my family members, is teach the language of non-identification. So we don't want to identify with things. We don't want to say things like, my depression is acting up again today, my anxiety is acting up again today. That is identifying and owning that, versus saying things like, I'm having an anxious day, I'm having a depressed thought today. That way we're not identifying, we're not owning, we're just watching it pass by. Kind of like watching the clouds pass by. We don't want to be that cloud, we want to be the universe, we want to be the sky. As a matter of fact, there's a beautiful Qigong practice that's called watching clouds pass. And it's just so very simple like this, where I'm watching my hands pass by, I'm slowing down, I'm being aware, I'm being present, but I'm not identifying with the clouds, I'm just watching them pass by. It's a beautiful way to not identify and to just at the end of the day seek happiness. It's really what we all really want. So there are parts of the brain and parts of, believe it or not, the heart and the stomach. There are more data and neurons that go from the stomach and the heart to the brain than the other way around. So we can change a lot of the neurochemistry in our brains just by things like diet, just like things like meditation, things like open and loving kindness from the heart. Serotonin, dopamine, 70 to 85% of all the serotonin starts in the gut and then goes to the brain. So just simple things like relaxation, getting what's called vagal tone. The vagus nerve, longest nerve of the body, starts from the brain, feeds down all the way to the feet and goes right back up. It feeds all the organs, but it also gets into what's called parasympathetic, that anti-fight or flight. We have sympathetic and parasympathetic. We want to stay more relaxed in parasympathetics. When I'm anxious, anxietal, and have depression and mental illness, I'm stuck in that sympathetic. We want to break that routine and create a homeostasis and balance. Chinese, it's yin and yang. Yin, think of more as parasympathetic, yang is sympathetic. And in Western medicine, we'll just use those terms, sympathetic and parasympathetic. So something very simple to engage the vagus nerve, because believe it or not, as it leaves the brain, the first or second branch goes, it's called the laryngeal branch, it goes right to the throat. So things like humming, things like singing, things like coughing, believe it or not, gargling, this will all increase the vagal tone, increase the vagus nerve stimulation, and therefore increases the parasympathetics. They're using tools right now that are called non-invasive vagal tone stimulators. The invasive ones is when the surgeon puts an apparatus into the neck to increase the vagus nerve. Now they're using non-invasive. They'll take a little electrical device, stick it on this. I've been doing this with acupuncture needles for years. There's a vagus point in the ear and a vagus point on the neck in Chinese medicine. Put two little tiny needles in there with a little bit of electricity and you're hooking up the vagus nerve and calming everything down. So, simple things, a couple of things that you can do. A, eat good, proper foods. Very important for the gut. Sleep. I can't tell you enough how sleep will engage parasympathetics and heal. Meditation. Slowing things down and just becoming aware. When I'm aware, I know what's going to happen next. Our minds are always going to the what ifs and the if only I was in a better job position, if only I had more money, if only I had a better boyfriend or girlfriend. These are just dreams. We can control what we can control. You can change your environment, you can change these type of things, but it takes an act of awareness. So when you slow down, I know what my next thought is going to be so I can have a better response than a reaction. Remember, when it comes to things like mental illness, anxiety, depression, that's not a flaw in somebody's character, that's a flaw in chemistry, brain chemistry. We could change that chemistry. We could use things like positive neuroplasticity. This is how we're changing the brain with just some things as positive thoughts, affirmations, gratitudes, all these things really help. Now again, we're not naive enough to believe that you could just do all of this without the help of other things like nutraceuticals or even medications, psychiatry, psychology. So remember, if you're having anxiety, if you're having depression and feeling these things, please talk to a friend, talk to a professional, reach out to somebody. We are all here to help. There's a wonderful organization called NAMI, N-A-M-I, which is the National Alliance of Mental Illness, and there's a great chapter in Charlotte that I'm actually a member of and getting very involved with. So please, try to do some of these things, try to just follow some of these ideas. They're simple, yet can have profound effects. Remember, mental health is very, very important. It's a disease just like any other disease and needs to be taken seriously. For Mental Health Awareness Month, we will see you next week. I'll be providing some other videos. We'll be having workshops and some other talks to offer more tools. Until next week,